Hi, my name is Kristen Ball, and I'm here to talk to you about age-related macular degeneration. Age-related macular degeneration, or AMD, is the blurring of the central vision. It affects millions of Americans and up to 35% of those over 75. Let's just start with looking at a picture of what it's like to live with macular degeneration. Notice on this side here, the faces are clear and you're able to see them clearly, but here they are blurred. This is what it's like living with macular degeneration. See, notice the central vision that has been lost? As it's a common diagnosis, I had no problems in finding someone to talk to that has macular degeneration. And when I spoke with her, I asked her what it was like, and she said, and she described it as living life through by looking at panes of frosted glass. And when I started thinking about that frosted glass example, I started thinking what sort of effects that could cause on someone's life. And I said, imagine not being able to see your grandchildren's faces. Imagine not being able to read the books that you love to read so much. Imagine not being able to have the independence of driving a car because you've lost the central vision and you can no longer see well enough to drive. And imagine not feeling secure eating in public because you're not really sure what's on your plate. All these effects just show how devastating the diagnosis of macular degeneration can be. Before we get too far, I thought we could go through just basically the parts of the eye, and just so that we have the basic knowledge as to where to start. But here's an eye, and if you notice here, the light comes in through here, goes through the cornea, through the pupil, hits the lens, and then it bounces on to the retina here. Okay, the retina here, and the macula is located in the back here. And it's the macula where the central clear vision is located. And that's the part where the faulty blood vessels grow in macular degeneration. As I said before, macular degeneration is that loss of the central vision, and it's that development of the faulty blood vessels. This can happen slowly or accelerated, but the thing that's important to know is that it causes no pain. So someone may not seek treatment because it's not painful, and they may not know that they're even losing their central vision until it's too late. Macular degeneration comes in two forms, the wet form and the dry form. The wet form is more severe. The symptoms vary differently for both forms. In the dry AMD, there might be a slight blurring of the central vision. There might be some difficulty recognizing faces, or you might need more light to do close work like reading or sewing. And there will be a small but a growing loss of the central vision. This may happen to both eyes, but it may happen at on one before the other. With the wet form, it's more severe and straight lines seem curvy, and the diagnostic test for it is with the Amsler grid. With the Amsler grid, if you have AMD, these lines will be wavy instead of straight up and down. If you notice any changes to your central vision, definitely go to an eye professional. Or if you are over 60, annual eye exams are a must. During the annual eye exams, the doctor will dilate your eyes to check the condition of the macula and the retina, or he will also use a puff of air to do a tonometric checking of the pressure. And then, once again, the Amsler grid will be used because it's diagnostic of wet AMD. Now that we've talked about the symptoms, let's move along to the treatment. The treatment is varied for both forms of the disease. With the wet form, there's the injection of anti-growth factors. And when they inject these halt the production of the faulty blood vessels, and there may be your vision definitely stays the same, or there may be some improvement. With the dry form of the disease, there are antioxidant and zinc vitamins, and then there will also be the use of the Amsler grid to monitor if there's a change towards the wet form. With both forms of AMD, annual comprehensive eye exams are important, and the use of vitamins, the AREDS vitamins, as well as the Amsler grid are important. AMD can be a horrible disease, and as the leading cause of vision loss in older Americans, the effects can be devastating. And as it's a painless disease, make sure that you know the symptoms. But there is something that can be done. Know the symptoms. Know that if there's any changes in the central vision, to contact your eye professional. And if you're over 60, annual eye exams are a must. And if you're prescribed the AREDS vitamins or the use of the Amsler grid, use them. Thank you very much, and have a good day.